remember sitting in that room thinking, nobody has asked a single question yet about why any of this is happening. So I'll start with a really personal story, actually, because I think it's the fastest way to show you exactly what I mean. A few years ago, I was in the middle of a significant health crisis, and I had been dealing with prolonged and heavy bleeding that was affecting my ability to work function day to day. And I was exhausted and anxious in a way that was just more than physical. It was even, emotional. And I was struggling in ways that I didn't have words for yet. So I went to see my provider, as we all would, right? And she handed me a prescription for antidepressant. Now, I'm a pharmacist. I've spent over 2 decades understanding what medications do and what they don't do at the molecular level, right? Like I knew exactly what that prescription was. And I also knew exactly what it wasn't going to. But, when you're really depleted, there's a part of you, especially when someone just holds out something that looks like an answer, there's a part of you that kind of wants it to be the answer. But I pushed for more investigation because it wasn't like we weren't addressing the biggest thing in the room, right? And so eventually I saw my gynecologist and we found something in scans. And then he looked at me and he said, and I'm going to quote him directly, let's just cut it out. Those were his exact words. And I remember sitting in that room thinking, nobody has asked a single question yet about why any of this is happening. Not about the bleeding, not about the anxiety, not about the exhaustion, not about any of it. And nobody had looked at the whole picture as a connected system. And that was a moment where I understood the difference between a medical system that treats problems and a framework that investigates, right, as a whole. And so everything that I do now and everything we're going to talk about today is it comes from that understanding.